Our next solution offers patient-centered messaging to create efficient and engaged care teams, reducing burnout and effectively managing risk. So here to tell us about it are Asif Khan, co-founder and CEO of Hucu.ai, and Gwen Gola, president of MPAC Healthcare.
All right, cool. Hey, everybody. Thanks so much for the time. It's going to be fun explaining what we do. So, Asif Khan. Hucu stands for two Latin words combined together. Hucu.ai. It means care anywhere. And plus, it's hard to kind of get two-syllable web names, so that's why we got Hucu. Just being honest here. So I'm here to talk a little bit about, let me tell you what Hucu is, and then I'll introduce you to Gwen, Pessis, who's the president of MPAC Healthcare, which is a provider group, talking about how they're using Hucu with skilled nursing facilities across 150 of them. So the way to think about Hucu is it's everybody knows how to message, right? Text message, everybody knows these days. So it's kind of like that, but it's expedites the care decisions much faster through intelligent protocols and automation built in, which results in people saving time and being able to provide more care to more people and better quality. So with that, Gwen, take it away.
All right. Hello, all. I'm Gwen Pessis, and I am the president and the co-founder of MPAC Healthcare. What we do is we provide services to skilled nursing facilities. One of the service lines we provide is Asif's Hucu communication platform. We provide on-site nurse practitioner services, mental health services, transitional care management. We just have an array of programs that we utilize in the skilled nursing space, assisted living space, in order to improve outcomes and really help facilities overall to consistently come up with ways to manage their residents. I got into the industry. I'm a physical therapist, and I specialize in neurological rehabilitation. I was working in skilled nursing facilities and wanted my patients to get better and better and better. Couldn't figure out why they were always bouncing back and forth to the hospitals. I wasn't getting the outcomes that I needed from a rehabilitation perspective. So that's when I met Tim Martinez, who's one of the co-founders of MPAC Healthcare. We got together and I said, I'm going to put therapy on the side for right now. We're going to come up with a system to really drive the results we want in the skilled nursing facilities. And we're going to go from the foundation up and figure out a way to do this. Let's go, Asif. Okay, so we have 5 of the main challenges, common challenges that we find in the post-acute space. Number 1, culture. Number 2, compliance issues. 3, growth. 4, high quality service. 5, satisfaction and retention amongst the employees. Prior to working with Hucu, the communication platform, all the issues that we all know going on in skilled nursing facilities, so many people, so many disciplines coming in and out all day long, really not an integrative approach to everybody, all the healthcare providers, all the ancillary services that we're providing the patients with, really no comprehensive organized system to monitor what everybody's doing, keep it in one place, so everybody involved can have access to that and really address all the needs for each individual patient. How Hucu solved these challenges. Really, as discussed, the purpose of Hucu is to have everything going on with the resident in one spot. So physicians, my company's nurse practitioners, social workers, LPNs, RNs, anybody, any clinical people involved in the patient's care, we're all on one spot communicating this. If we need to initiate a telehealth visit, we can hop on the Hucu platform, bring in physicians from the hospital, patients, primary care physicians, really anybody involved in the care can hop on the Hucu platform and communicate real time in one spot. Number 2, assuring private, secure PHI data, and avoiding litigation. Another really cool part about Hucu is that we can send everything going on with this resident, so all their comorbidities, what's going on that day, anything that the mental health providers are providing about that resident, anything that the nurse practitioners are seeing that day, the LPNs, the RNs, we can put all this really specific data in one spot and know that it's following compliance, know that it's following PHI secure data platform compliance, and we don't have to worry about, and we can remove that while still remaining in total communication about the patient.
Cool.
All right, number 3 is reduce staff burnout. I think this is one of the coolest parts about this. When we initiated the communication platform in rural Illinois, which is where my company, in combination with Hucu, rolled this out initially, these staff members were so excited because finally these RNs, LPNs, CNAs that had been so isolated in the rural space for so long and didn't feel like they had access to all the latest and greatest healthcare practices. They finally had access to nurse practitioners and physicians wherever they needed to get in touch with them, bring all this information together, and now they actually had access beyond was being provided in their facilities. They had this extension into all these people outside of whoever was coming to the facility.
Yeah, one thing I would notice, I have you guys think about like how it works. So if you're seeing the screen, it's talk about Leah Sean, who is like the patient. So all the team members who are responsible for Leah's care are in that one group of messaging. So it's not like, one stream of messaging which includes like 15 different patients and you cannot share PHI. So all the primary care or the MPAC nurse practitioners or the therapy folks and the floor nurses and LPNs, they're all in Leah Sean's channel, and now they're all communicating. So if Gwen and I are talking about this patient, the other people know what we're talking about. So that just accelerates a lot of care decisions and delivery. So with MPAC's group, what we have seen is 64% of the people, they're saying it saves them time, and 57% it's saving at least an hour a day. That's huge when it comes to time savings, and so they can provide more better care, and that's actually the cause of reducing the burnout. Because if you're getting an hour a day extra, then you're less stressed and you less have to worry about things.
Yep. So improving outcomes for patients. So our nurse practitioners are in the facilities, and the nurse practitioners also have access to what's going on in the facilities through the Hucu app. So when they're arriving at the facility daily, everything's organized and ready to go for them. The nurses have already flagged the residents. The nurses have already recorded what's going on, why the nurse practitioners and mental health care providers are not in the facility. So they get to that facility, everything's already ready to go. All the timely updates are ready to go. And now we can get to work and see the patients.
Yeah, and just to add on that a little bit, to have you guys think about the context, how it works is, think about a nursing staff at night or over the weekend or during the day. They need help. They identify the situation, they need help. Usually they reach out to the dawn or others, but if it's at night or over the weekend, who should I call? What number that person can be reached at? So it's very confusing. So in Hucu, that nurse would just go into that patient channel and press a flag, and that's all she needs to do. The MPAC nurse automatically gets notified, comes right into the channel, collaborates, have a video conference session if they need to, and be done and move on to the next one. So it just helps increase transparency and accountability. And think about like how many times the staff just calls 911 and just sends the patient out because they don't know who to reach out to, who's going to help them, whatnot. So this really takes care of that challenge.
And they also have now a list and a documented, documented encounters of what has happened leading up to this patient's needs.
Yeah. So 73% of people, they say they really enjoy working with Hucu as compared to using a phone and then an email and then a text and then a voicemail. So it's just one place where the entire team is.
All right, so 100% of people say they are satisfied for communication and coordinating care within the organization because of all these reasons that we've talked about. Improving culture in the facility, as Asif discussed, reducing time for seeing the residents because everything's in one spot, so everything can be addressed based on what they're finding in the communication platform and not relying on all the different disciplines to provide feedback, as Asif said, from phone calls, notes and charts, et cetera. We've got supportive team now. We got all the team members, all the healthcare providers in one spot communicating, which is all leading, of course, to what we're all, the goal of all of us in the facilities is the best patient outcomes possible.
And it's important, like when talk about supportive teams, because Gwen's team, MPAC, is a provider group, right? So they're like an extended team to the facilities, and many times, it's more than just solving this problem or that. It's kind of like you're part of a team. So if the facility staff feels that they are covered when they need by this provider group, it just makes them feel more empowered and feel good about their work, that what they're doing, and it keeps them feel more like they have their back covered.
I think also, because the facilities have so many people rounding and coming in and doing different things, this is really a way to, not see MPAC and not see everybody as individuals with their own initiatives and intentions in addressing patient care. It's really bringing everybody together. So, MPAC isn't an outside service, Hucu's not an extra service line. It's really bringing everybody together to function in one spot. So the perception is to these residents and these family members, I've got one healthcare team who's got my back.
Yep. Oops, sorry.
So in my opinion, with all the different, my company works with about 45 to 50 different operators across the United States. In my opinion, in our group's opinion, this is really the only time, Hucu is really the only technology app concept that we've seen that really is taking this approach to comprehensive care and solving the solutions in the skilled nursing space, in the post-acute space that other telehealth companies and other technologies have not been able to solve, and that's really because of their comprehensive approach.
Yeah, and I think I would say is like there's lots of telehealth solutions out there, but the way we look at it is telehealth is just one part of communication, right? You're on video. But so there's a lot of things go on before telehealth, and there are lots of things going on after telehealth. Mm-hmm. So you have to think about that entire team and how they're communicating with each other. And the way we think about making it super easy is just texting. Give people better texting, intelligent texting, which they're already used to, so they can get going. And a facility can launch within 30 minutes. There's a free version on the web. You can go and start communicating on the free version. So we make it really, really simple to communicate.
It's very simple. It takes away the intimidation factor of technology too, which is an issue, as we know when we come into these facilities, like technology. This sounds complicated, it's a communication platform. It's super simple. If I can do it, I think anybody in the world can probably be able to manage it. The other super cool part about this is Asif and Laura, who is Laura's Asif's partner. If you have a technology issue or anything going on with the app, you can hop on this platform and you're gonna get Asif and Laura or somebody from their team a response time immediately, which is a really big deal because if you're depending on this communication platform to get you through your day, because we become so dependent on it, it becomes the driving force, the foundation behind how the facility's functioning. So if you've got an hour, this platform's down, what are we gonna do? you've got Laura and Asif that are going to resolve that immediately. So just the hands-on approach, the response, the emotional, physical investment from the Hucu team is one that I think can't be matched.
Yeah, so what Gwen is talking about, our support is already in the app. So it's not like you call an 800 number, log a ticket, and somebody reaches out to you maybe. So our support is embedded in the app. So you just message whatever you need, and we're there. Our support teams are there supporting. So we are ranked the highest on G2 if you compare other technologies consistently, and happy to answer any questions.
Is there any kind of integration with your EMR, lab, X-ray? That's the first question. And then related to that, does the communication in your app make it back into the EMR?
Short answer is yes. We are already integrated into post-acute care EHRs.
Okay. All right.
Any other questions?
Okay.
All right.
All right.
All right.
Thanks, everyone.